But let's start sort of with elementary. Let's have Dr. Malone from the OBGYN perspective just give us baseline definition of menopause and how we treat it.
Sure. Baseline definition of menopause, which is what everybody's taught in med school, is that menopause is when you've had your last menstrual period and it is confirmed by not having another menstrual period for 12 months. Well, okay, well, that's an event. But what we didn't know a lot about and we didn't talk a lot about was the transition to menopause. And that's a very long process. That is not an event. That is a phase that can take years, anywhere from 4 to 10 years. For African American women, it's closer to the 10-year mark. And it is marked by all the symptoms that we associate with menopause. They don't just happen once you've had your last menstrual period. They start as early as the decade before. And what we are finding, and what I have been doing for the past 30 years, is figuring out how to treat those symptoms of menopause, which can be quite devastating for many women and bothersome at best. And those are hot flashes, mood swings, brain fog, all those 34 symptoms that women have. But I think that the misconception has always been is that it starts at menopause. It doesn't start at menopause. It starts a decade or so before you've actually had your last menstrual period. So the good news is that, we are now coming around to this definition, and women are understanding that to seek care and what does treatment look like. Menopause is a hormonal event. Perimenopause is really characterized by vast fluctuations in your hormones. They're up, they're down, and everywhere in between. Menopause is really defined as the moment at which your hormones, your ovaries have stopped functioning, stopped producing estrogen and progesterone on their own, and you will remain low from that time forward. So it sort of makes sense that when we are looking at treatments and how to deal with a hormonal process, that hormones actually are part and integral to that problem. So hormone therapy, either in perimenopause or menopause, is really the keystone because it is the most effective treatment for the symptoms of menopause. And as we'll hear from Dr. Moscone, also important for preventing some of the long-term consequences of that estrogen deprivation as we age.